Hello and welcome to our program. I'm Peg Young. As the densely populated Northern Hemisphere braces for a winter season, we are seeing a resurgence of COVID-19 cases across the globe. Countries in Europe have brought in strict new restrictions to curb the rapid spread of the virus, including overnight curfews. With the pandemic causing widespread economic damage, the world is once again facing a dilemma of having to choose between public health and the economy. Joining me today in the studio to discuss this topic in more detail is a panel of 3 foreign correspondents. Glad you could join me. Europe has overtaken the U.S. in the number of new daily COVID-19 cases, re-emerging as a global hotspot. In an effort to curb the resurgence of the virus, France imposed a nighttime curfew in major cities, and Portugal declared a state of emergency to restrict movement. The IMF projected the global economy to contract by 4.4% in 2020 as the pandemic continues to wreak havoc on economies. Amid a heated debate over the need for another lockdown, governments are struggling to strike a balance between protecting public health and the economy. Now, Europe has surpassed the U.S. in new daily COVID-19 cases for the first time since the peak of the infection in the spring. I'm aware in the U.K., new cases have quadrupled in the last 3 weeks.
Yeah, it really is a dire situation. I've never had the sense quite as acutely as I have right now of the UK being in another world, not just another part of the world. It's kind of unfathomable compared with the situation that we've enjoyed, relatively speaking, in Korea. The pattern, if you look at the graph, it's like vertical since the end of the summer. There was the early peak in April. It came down again. People opened right up again over the summer. And as we move towards the last few weeks, it could get even worse. Overall, well over 700,000 infections and not far off 45,000 deaths. And it's even worse in France, I believe.
So the situation isn't looking too great for France, actually. The French government imposed a curfew starting October 17th in major cities across the country. What is the situation like there?
It's been picking up slowly during summer, but since late September, it's extremely severe, like Alex mentioned about this kind of curve, very steep. Just to give an idea, now we are more than 30,000 new cases daily. That's the very worrying situation. It's only going to get worse in the coming weeks, and so we are expecting a very tough winter. That's why the government has taken some very stringent decision last week, which is actually imposing a curfew in Paris and 8 other major cities, which means after 9 p.m. you are supposed to be home until 6 a.m. So they imposed this for months, but people are worried this might last several months. Then maybe one silver lining is that we are seeing this curve like this, but the mortality rate is far below than what we saw last spring. There's far less number of people the rate of mortality is far lower. So that's encouraging. We don't have all the explanation why it's the case, but at least that's a silver lining. But of course, if you have a big number of infection in the coming months, you might, of course, still gonna have a very severe death toll over the winter.
Well, it's September now, or October now, and so we've had months of lockdown, talk of lockdown, restrictions on how we move about, and the U.S. has the highest death toll so far from COVID-19. Health experts are saying that the surge for the fall has just begun. What's the situation looking like?
Yeah, the U.S. is actually talking about a third wave already. They peaked in the beginning, they peaked in July. They saw a dip in September, and I think that encouraged a lot of people. Kids started to go back to physical school. Not everybody, most of them have a choice. But, there were the beginnings. And then the numbers started to spike again. And right now it's astonishing. The U.S. has had more than 8.1 million infections total. With the recent spike, I think they're at an average of 55,000 per day. The deaths are more than 219,000 deaths. The deaths are remaining below the peaks that they were in the beginning. I think part of that is also treatments are more widely available. Doctors have more experience. In the beginning, nobody knew what this was. But still, the totals in the U.S. are amazing. Many states have reached records this week. In fact, my home state of Idaho, which had remained relatively unscathed, saw 670 per day this weekend, which is a huge number for them. The other troubling trends in the U.S. is that you're seeing a shift in geography. In the beginning, the epicenter was mainly on the coastal areas, and it has moved to the heartland and to rural areas. And I think that what people are talking about, what is happening there, is there were lockdowns. They complied in the beginning with the lockdowns. And then the numbers started to improve, and they relaxed the restrictions somewhat. I heard a politician in Utah speaking, and she was saying that, people will wear their masks to the store, and they'll wear their masks to public facilities, but then they have a family reunion, and the masks come off, and that's where they're seeing the clusters break out. So it's interesting that we see kind of this false sense of security.
Now, amid an outbreak of cases among White House officials, including President Donald Trump, there are reports that the White House is considering a herd immunity strategy that was tried in Europe first. What do you think of this?
The idea of herd immunity, the way that they are plugging it, is that it would be sort of a quick fix without a vaccine, because basically you get to the point where so many people have been infected that it stops spreading. So they say, let young, healthy people get infected, protect the elderly population and the vulnerable populations, but let the young people get infected, and then we will have this herd immunity and stop the disease. The problem, herd immunity has never been tried without a vaccine. But a group of scientists that are supportive of the White House and friendly with the White House issued a petition calling for widespread economic reopening in order to expose younger people to the disease while protecting the elderly population. And that is what the White House has most recently supported. There was a call last week with 2 senior administration officials, and they supported this petition. The petition has been widely debunked by many scientists, and the Director General of the World Health Organization also basically denounced it, saying that herd immunity is not a strategy. It's never been tried without a vaccine, and that he said that possibly even if herd immunity were achieved to the levels being predicted, which is unlikely according to his estimates, but even if that were to happen, still 500,000 more Americans would have to die.
Just want to add on the end of that, is there any firm evidence that you gain immunity to COVID-19 or retain immunity to COVID-19? These are huge questions that
well, this experiment actually was taken on by Sweden, and so we saw a huge spike in deaths there, but afterward there were some media acknowledgement that that allowed for the country now to be in a better position to face having to go through winter without a vaccine because they had many of the population already exposed.
Yeah, that's a big question. We should know a lot about this disease, and I think scientists and doctors know a lot more than they did in the beginning. We know the basic tenets, right? You have to keep your hands clean. Wearing masks is undoubtedly a way to prevent the disease from spreading. But what they don't know, there have been studies about antibodies, for example, and how people develop those, which would be a signal of immunity. And that hasn't been proven to be the case even among people who have had the disease. And of course, now we're seeing, very small numbers, but we're seeing some reinfections, which is troubling. So there are questions about whether the virus is mutating. A lot of things that we don't know.
China, where the COVID-19 outbreak began, has confirmed new cases for the first time in 58 days after Chinese authorities claimed they had beaten the virus. To find out more, we connect to Dr. Richard Cheng, American physician treating COVID-19 patients in Shanghai. Hello, Dr. Cheng.
Hi, thank you for having me.
As a health expert, what do you make of the recent outbreak in China, especially after the country reported 0 local cases for weeks?
Well, that's a great question. We do know that China has been relatively successfully containing COVID-19 outbreak. But we also know that the SARS-CoV-2 or the COVID-19 virus is still lurking around worldwide. I don't think we can really cure the virus entirely, but until we are able to contain the virus worldwide to a very low level, you will see this kind of focal outbursts everywhere, including China, because that's going to happen because people flow and travel. So that's not surprising at all. And I hate to say, we hope hopefully it won't happen, but we will see this everywhere, every part in the world. So we need to remain vigilant, and that's one.
There have been cases lately of reinfection, with some of them leading to deaths. This has generated skepticism about the effectiveness of an antibody or a vaccine. What are your thoughts on this?
First of all, let's go back to SARS-CoV-2, the virus. SARS-CoV-2 is what we generally classified as a respiratory virus, meaning it belongs to several families or several categories of viruses that primarily cause flu or common cold or respiratory illnesses. And we all know people get colds every day. I mean, every year. And every year we have a flu, different, a predominant different flu, influenza strain, virus strain. So every year, the government, public health advises people to take flu shots, flu vaccine shots. So we do know. Why is that? It's because viruses mutate. They change all the time. And SARS-CoV-2 virus is the same. It mutates, okay? There's an article in Nature, one of the top magazines, in September, just last month. Up to now, there have been at least 12,000 genetic mutations identified. So we know, to answer your question, when somebody recovers from a SARS, COVID-19 infection or exposure, here I want to clarify a little bit. So people are very afraid of, the term of catching COVID-19. But like COVID, we know a lot of people catch the virus, but don't develop symptoms, okay, which is a good thing. We need people to be exposed to a virus and develop immunity or antibody, and then don't develop symptoms.
Thank you, Dr. Richard Cheng from Shanghai, China. Thank you very much for joining us today. So what is your thinking after hearing the expert?
Recently, there was a small cluster in the city of Qingdao in Shandong, where they identified like 12 cases, including 6 asymptomatic. So the government has a very stringent approach because they basically tested the 9 million people in the city over the last a few days. And now they identified, and they say that the origin of this cluster was like some people working in the dock, working in the harbor, and so they had been in contact with some product that were imported. So the official line in China is that these cases are coming imported, and so China is a clean environment, a protected environment. So of course that's what the government wants to say, but clearly, so far, the situation in China has been very much under control, and the life is coming back to normal. But as the professor said, I mean, China is always at risk of a relapse because, of course, the immunity level is very. We are very far from herd immunity in China for sure. So the entire country is going to be on its guard until there is a serious vaccine. So that means we are going for a long, protracted war against the virus.
Yeah, I mean, hearing about the China situation is, as Sebastian said, both encouraging, but there's an asterisk next to it because it's also concerning. How far can we entirely trust the official data? But more than that, can we trust vaccine breakthroughs coming out of that country in the future? A lot of people, for example, in the US, inherently won't trust it. One other thing the doctor said about lack of symptoms being a good thing, well, of course, if any of us get COVID, we'd love to have no symptoms, but it also makes it dangerous. You can move around and spread it to others without yourself showing symptoms. That's why COVID-19 has been so prevalent. And I go back to the point I made earlier. I wouldn't want to be a guinea pig personally because there have been rare complications, but when you have enough people being infected, those rare complications in young people are quite horrendous.
Yeah, and I think you have to also factor in, you know, yes, you may have young people who are asymptomatic, but these young people are going to come in contact with their grandparents, or they're going to come in contact with other people in the population, and that's exactly how this virus is spreading in such a fast way.
Despite the renewed surge in the virus, countries are cautious about returning to a full lockdown, fearing the damage it would do to the already struggling economy. Now, many think another lockdown in Europe seems unlikely, but some health experts argue that a full lockdown is necessary before it's too late.
Yeah, well, there is, I think, a very mixed attitude around the world towards deeper lockdowns. Here in Korea, I think there are several reasons why we've done extremely well. And if I was another country, I would be looking at Korea above all. There are some other more isolated countries that have done well, but Korea is a nation that's seen travel, that's seen the economy continuing to function, that's never really locked down in a particularly profound way as we've seen elsewhere, and is still doing okay. And they're also going to have to put trust in a government that, frankly, has not deserved that trust in the UK because high-level members of that government have themselves flouted the rules. But if you don't put trust in your elected government and you try to do it on your own, unfortunately that's proven to be ineffective because people do things in different ways and you cannot break the circuit, beat the forest fire, whatever analogy you want to use, without cooperation.
What is your take on this, Sebastian?
The situation now with the lockdown, most countries, the government are taking stringent rule in Europe, but they're all saying we don't want to go back to full lockdown because lockdown is actually a last resort decision. It was invented in China because the situation went off control, but the economic cost, the psychological cost is heavy on society. We saw that in spring. So most governments are trying to prevent that. So for example, in France, the curfew measure is seen as a way to prevent a full lockdown. And the government is saying that a full lockdown, for example, will cost 15 times more to the economy. That's their figure. There's a lot of side effects that we haven't been able to calculate, even like people who are lonely, people who are like old people, people who are old, who are living alone, who can't stay stuck, isolated from society for many months. I mean, lockdowns are punitive. We can only hope that Europe can avoid that. But this is a big question mark for the coming months, I think, and the heart of winter, of course.
So you've brought in some very interesting articles. Let's go with you, Kim.
It's titled, "The U.S. was the world's best prepared nation to confront a pandemic. How did it spiral to, quote, almost inconceivable, end quote, failure?" So the U.S. had been rated #1 as the most prepared country to face a pandemic. It had a pandemic playbook, which had been passed down from the previous administration. And that laid out sort of the steps to take when you were faced with a health crisis. That was not followed. But also the study that rated the U.S. as the most prepared, which was the Global Health Security Index, had ominous signs already in the beginning. This wasn't something new to America, but the U.S. already had, was low ranked in terms of high income countries for doctors and hospital beds per capita. Already that was a problem. Also, as I think we all know, a dismal rating for access to health care because of the insurance system there and the way that works. The pandemic playbook said that basically laid out the decisions that should be made and agencies that should be mobilized. And it stressed early response is vital, and that early response should be coordinated by the federal government. And that's the key, is that the Trump administration in the beginning of the pandemic basically passed the ball to the states. But in America, you have 50 states. And without a coordinated federal, very strong response, the states were left to their own devices. And so you had the states, basically each one mandating its own lockdown, each one trying to figure out the testing policies. In the beginning, states were even fighting for vital medical equipment that was needed to fight the disease, because there was nobody telling them how to assign this. And so that's why you saw very high death rates, which were shocking in the US in the beginning, because they didn't have the respirators. States were fighting, even cities were fighting over respirators. So I find this article very interesting because it really lays out the case for the way the pandemic should have been faced, and is not politically focused. It's focused on the science and the actual events that took place.
Okay, so going off the playbook.
Correct.
Now, Alex, what did you bring us?
Well, we've had this already mentioned a few times today. As virus surges in Europe, resistance to new restrictions also grows. Pandemic fatigue being a major challenge when trying to enforce these new measures. They're coming up with new words like circuit breaker rather than lockdown, for example, in the UK. But also this article highlights how different the attitude is now compared with last spring. Political calculations also coming in for democratic governments who need to rely on re-election rather than other parts of the world, let's say. You can fill in the gaps that don't have that problem. And rather than a consensus of solidarity, new rules are being legally challenged as well. There's a risk of public unrest. There's a phrase here which I liked: sowing confusion, not slowing contagion. And as I mentioned before, in Korea, like it or don't like it, the rules have been very clear to everybody. This is what you got to do. Whereas friends and family I know in the UK, they're like, well, I'm not sure what Tier 2 means for me. My friend in the neighbouring town's in Tier 1, and can I see my daughter, and who's in my bubble, and all these questions. I think, without wanting to do a discredit, individuals are very intelligent, but the public at large need to be treated in a way that leaves no room for confusion.
So having had lots of options was something that deterred from actually having an impactful control over the disease.
Yes, and the article even says punishments may be insufficient, especially when you look at government officials breaking the rules.
Okay, and this is just as we enter the winter season, right?
Exactly right.
And what did you bring for us?
It's called The COVID Economy Carves Deep Divide Between Haves and Have-Not, explaining how the new economy that is emerging during this era of COVID and lockdown is basically increasing the divide between low-skilled worker and high-skilled worker, because basically you see people who can have a job that can work remote with their laptop home, their job still is secure, and they have a more stable prospect. But low-skilled workers who are working factory or in a shop or delivery man, these people, they are they lose their job much more easily, or they are often in a far stable contract situation, they are freelancing, and those ones, they can't work from home basically, they have no option. COVID is actually accelerating some social divide among societies, which are extremely worrying. So it's extremely concerning, I think, for the coming months and years, and it's extremely concerning, especially in underdeveloped country. So I think that's also something we have to watch for the coming years.
It's a very important point, and I wanted to ask Sebastian actually if there are welfare solutions that come out of this, because when I said earlier about a forest fire, you can't, when there's a forest fire, just sit by and do nothing. And the people who are being affected by that, you've got to go in and evacuate, you've got to help. Is there a lifeline there?
Well, it depends on the country. I mean, some country, like in Europe, for example, there's a very generous welfare state. So on the short term, for example, in France, the state has been extremely generous. So basically, all the people who lost their job, they were covered, their salary, 100% roughly, were covered by states. But the problem is the state triggered this over spring for a few months. They thought it would be for a few months, but we are looking now for years ahead. So how long the states can afford this? And I'm talking about Europe, which has a more advanced welfare state than in the US or many underdeveloped countries.
Yeah, I think that's a really important point is when these measures were implemented, like in the US as part of this stimulus bill, everybody received a check for $1,200, right? But on top of that, people received unemployment of, I think, $670 per week. And there were rare cases where some people were actually making more than they made before. Those were rare cases because, you know, most people have families and they were suffering. But that ran out the end of July, right? And so that's over. Now we're locked in an election year, you know, political bickering over the next stimulus bill. But for sure, over time, we're going to have to see some long-term solutions.
So many people facing questions that they didn't think that they would be facing in their lifetime. I think perhaps we are all dealing with questions that we didn't think we'd have to face. And as this year continues the way it has, each of us are having to face the fact that perhaps we really are going to have to come up with some sort of solutions, answers to these questions. We'll continue to think about it. Thank you all for joining us today.
Thank you.
Thank you
very much.
Now, that brings an end to today's episode. We'll be back next week for another discussion on the latest issues making headlines in media. Thank you for watching.